Yeah, son, you better warm up here, man. We're gonna be grilling you hard.
I'm ready, man.
I've been
I'm
looking
ready.
forward to this episode for a long time because we have the Sunny Virdi on the pod today. Welcome to the pod, my man.
Thanks, guys. I'm looking forward to it. Been following you
Yeah,
guys for a while and huge fans of your guys'.
Oh, don't lie.
yeah, right. Some dental student and some dentist from Alberta here. He doesn't give a shit about us. This is
Yeah, exactly.
DMD Sunner here, man, and the whole country knows about this guy.
Hey, man, if you're with Neki, you're good people. I trust this guy with everything. So,
What's this I hear you graduated? Like I follow you on Instagram. You graduated how many years ago?
so I graduated in 2016. So it's
You're
been
kidding.
6.5 years, something like that.
If any of the listeners have not seen Sunny's Instagram, like it is ASMR for your eyes, if like in a dental context. It is nuts. It is absolute bonkers.
Oh,
26.
thanks, man. I appreciate that.
I think we just got to dive into it here. Like, Sunny, man, before I even talk to you about your history and how you got into dentistry, I want to hear, how did you get so damn good at fillings?
Man, you know what? When I graduated, I left dental school like pretty uninspired. It was like looking forward to working and finally making an income. And after all the things you go through as a student, you're looking forward to living that like quote unquote lifestyle. But yeah, really wasn't what I thought it was going to be. And I was just going to work 9 to 5, clocking in the hours, go home. Yeah, just wasn't feeling fulfilled in the career. And then one day I ran into a specialist who had come to the city recently. And I was explaining to him, like, yeah, I don't really like this. He's asked me if I wanted to join a study club. And I was like, I don't know. I don't think so. I didn't know what to do. I didn't know if I want to be a dentist anymore. And he's like, listen, just shut up, come with me. I'm going to show you some stuff and hopefully change your mind about what you're seeing. And I started going to Instagram and seeing all these people do this amazing work. And I asked my buddy, like, can we do this? He's like, yeah, watch. So he was a periodontist. His name's John Ternakis. He's a periodontist from LSU, and he introduced me to his work and another guy here, Jose Viquez, who's a prosthodontist. Their work's out of this world. Like, they're on Instagram. They don't post much, but their stuff's ridiculous. And they introduced me to this whole world of like amazing dentistry that you could do. And from there, I learned about isolation. They brought in this guy, Victor Guerrero from Peru. And if you haven't seen this guy, you think my work's nice, go look at his. I feel like crap when I look at his work. It's ridiculous. So they brought him in to teach us about rubber dam. I've taken the course twice, but it's just on rubber dam isolation. A little bit of preps, but most
Really?
like who
What?
takes a course on just rubber dam isolation for the we didn't talk about bonding, we didn't talk about anything, just isolation, a little bit of onlay preps, but mostly about how do we isolate teeth. And it taught me that when you isolate everything, you can do anything. You have freedom. Like, do whatever you want. You have time. There's no rush. You create opportunities for yourself because patients are hard to work on, but this makes it easier. So from there, I started taking more courses and getting in with the Style Italiano training that they offer, and just looking everywhere. Basically, I was trying to approach it from like, I'm a big sports guy, so I was like, what would a basketball player do if you want to get better, right? Just get in the gym, put the reps in.
Yeah.
So I
That's
started
awesome.
doing that, and then all the hard work later. I mean, if you look at my Instagram, when it started to now, I don't delete anything, so you can kind of see like the progress from
Keeping
whatever
it real.
years ago to now. So yeah, that's that whole thing in a quick 5 minute story.
Can't believe you. That shows true dedication. If you can do a whole course on rubber dam isolation,
Twice,
you
twice.
you are going to be the LeBron of, how LeBron has, I spent $1 million on recovery. You're going to be like, I spent $1 million on rubber dams. But I'll tell you a quick I'll tell you a quick story. I almost dropped out of dental school because I couldn't, like, the rubber dam day, right? So we do like mannequin heads, right? So we like put rubber dams on mannequin heads. Mannequin heads, the teeth are just plastic, so it's easy just to like rip the dam around, right? It's like it's no big deal. Remember the first day we actually did it on a person, and I was like, we were actually doing a procedure, and I put the rubber dam on, and it was like I was sweating through my gown, I was sweating through my scrub hat because I could not get the bloody dam on. And I'm like, how am I going to do this whole procedure if I can't even get the dam? It was crushing. It was absolutely crushing. I'm like, this isn't the profession for me. I'm sorry. Like, I can't get this dam on. Like, the clamp will go on, the dam won't go on. I can't do any of it. But like, how do you go from being, you know, someone who dislikes dental school to being, you know, probably the textbook definition of an insane composite? How does that happen?
Yeah, it's fine. It's funny hearing you say that. It's the exact same experience I had in dental school. Like I was like, there's no way I can do this on my own because I don't know how to do any of this stuff. I always need someone to bail me out like every appointment. I was so stressed. And but for me is mentorship. Like that was the biggest thing, was finding people who are doing the things that resonated with me. And I was like, man, that's really cool. I want to be doing stuff like that, and seeing how what it does for them personally and professionally. And yeah, getting in touch with them. So mentorship was everything for me. Changed my life. I always tell people that, like, I'm proud of our Winnipeg roster that we have of dentists here. And there's a few people here who are really pushing things and trying to say, like, who cares if we live in Winnipeg? Winnipeg has its own rep or whatever, but let's do the best we can do here. And that mentorship helped change my mindset and try to make me the best that I could be.
How do you find a mentor? Like how I would love to have another mentor to help me, but like I bet you my fillings now look like your fillings did in first year dentistry in the sim lab when you're just learning to do a composite, man. 15 years out, and I bet you I still get all the brown stains that you're polishing out of there in first year, man. I'm embarrassed.
It's all good, man. Your surgery skills put everybody to shame, man.
Yeah, right.
So I don't do any surgery in my practice, by the way. Do absolutely
Really?
zero. Murad,
What? Like you don't pull any teeth or anything?
zero, because I can't put a rubber dam on. I
Dude, that shit is the best part about dentistry, man.
Man, blood, you. No, I need a rubber dam on. I need to like see what I'm doing. And surgery does not. Those two things are two opposite fields. Like I saw one guy do an extraction under rubber dam on Instagram once, and that made me think like maybe I could, but it didn't seem like it
I mean,
could.
he's not swallowing the tooth, I guess. So sure.
Yeah. So
It's got a
Murad,
pool of blood underneath that rubber dam, just
Oh
piling
no.
up.
oh, so
Gross.
Murad does all the surgery in our office, and he's so proficient at it. That's the nice thing about group practice. But man, how to find a mentor, that's one of my favorite topics. So there's three things I always think about. Like I get that question a lot because people see me all with my friends that are maybe not in my age group, and they're like, why do you have so many friends like that? So three things. One, study clubs are huge. I definitely recommend going to study clubs. As a new grad, you may not feel like you get it, and that's okay. It just opens your eyes to things that they say, like, you don't know what you don't know. Like, that's it. You get to see things that you've never seen before. So study clubs are huge. And I find, like, even locally here, the study clubs, like the new grads and the experienced docs are like really getting together, and people are finding like new opportunities and jobs. And so I think study clubs is number one thing you can do for yourself. But there's not always study clubs. Like I know there may not be study clubs around you, Neki, that you could go.
No, there's not. I am the study
So
club, man. I'm on your Instagram learning.
yeah, so that's fair enough. So like conferences is another one, and I
Yeah.
get the virtual learning. Like it's so good to have that, but I think you got to go to one or two conferences a year, and hang around after and like introduce yourself to the speakers or people that inspire you to do better, and afterwards like at the hotel restaurant or like the lobby bar, like everyone's hanging out after, and the best conversations are after the program. You really get to hear like the day-to-day in and outs of what they do and get to know them personally. That's been a huge influence over me. I have learned almost as much after the courses I have in courses. So that's a big thing. And I know it's weird, right? Like after COVID, like things are so different now. Like that in-person experience started to wane a little bit, but I think we got to bring it back. And I think it's going to be a lot on our generation of the new dentists to keep that thing alive. And I think it's so special. Like when I go to Seattle Study Club Symposium, I leave feeling like I could do anything. It's such an inspiring group of clinicians that get together. So definitely go to a conference once or twice a year. And
Yeah.
and then local dogs. Like there's got to be somebody nearby that you're like, this is awesome. This guy's doing it so well. There's so many great, amazing clinicians we have, especially in Canada. And yeah, I think you just got to reach out, because what do dentists love more than fixing teeth?
Talking about themselves.
Yeah, they love talking about themselves. It's their favorite pastime, man. We love talking. So go talk to a local dentist. That's someone that inspires you.
This
Because
podcast is never going to die.
we love it. You never, they may not be on Instagram, they might not be at the conferences, but they're still doing amazing stuff, right? So I think it's worth it, and it's a two-way street. Like you don't feel like you're bringing like you're just burdening somebody, like, oh, I'm going to reach out, I'm bothering them. No, it's a two-way thing because they're going to learn stuff back from you, and you form a special relationship that way. And that's been my experience. So those are my three tips how to find a mentor.
Dang,
Hey,
I like that.
hey, Sonny, on that point, like you said, a lot of your mentors are older than you, and they're, you know, a lot of the people and a lot of the mentors you look up to are typically older because that's what you value them for, and that's why they're mentors. How do you keep someone like that who's more successful than you, better than you in a lot of ways? How do you keep them motivated to help you?
So, and that what we touched a little bit is that it's a two-way thing. Like it's not just ask and take. It's also give. And I'll share my perspective for saying, I get that we've been doing this for so long, but start to ask questions like, well, what about this? And what about this new stuff that's coming out? And dentistry can be trendy, like things, it's kind of a pendulum, and they also have perspective and say, yeah, we were actually doing that in the 80s. I know it's looking cool now. We did this all already. Like with all the minimally invasive stuff, they're like, we did this with gold. The Tucker talked all about this. We were doing it for a long time. So it's cool to have perspective, but they value that, like you're learning and trying to make things better and not just like taking things, for their word, so to speak. You're looking to improve things as well. So bringing your perspective into it and trying to help any way you can, they appreciate that a lot. It's got to be two-way street.
Man, I totally hear what you're saying because like people reach out to me, I try to help them, and then you never hear from them again, and you're like, well, I guess I helped them enough. But
Yeah.
do you ever get haters on Instagram? Like, I don't know how anyone could hate your stuff, but what I'm thinking and what I noticed, Sonny, is I look at your early work, it's phenomenal. Your work has always been phenomenal. But then I think someone may have said, it looks great, but he's not checking his bite or something. Cause then I started noticing you started showing your occlusion like with your bite marks, and you're just like, see you mofos, I can do this shit and have good occlusion. Like, am I right? Am I right?
100%. But that
See?
specific story, it did come from somewhere. But so I have two partners here in the office, and we are so hard on each other. Like we push each other. You do not leave a bite wing up in the office because we're all coming to look at it and be like trying to figure out who did what work, and we're all judging each other. And if you see any black line, it's like, oh, you just like open margins now. Oh, you don't care about your patients. Like we're so brutal with each other. We do not make each other feel good. So one day my partner Todd says to me, he's like, "Man, you post this nice work on Instagram, but like, show the occlusion." And it didn't happen because I do that, and then I erase it away. Show me the bite marks. I'm like, "All right, no problem." And I did it, and it kind of resonated with a lot of people because I think everybody was wondering the same thing. So it was a
Totally, man.
way of him pushing me to be better, but yeah, good came out of it. So
I look at my like when I used to do a ton of fillings, I'm like, yeah, I made it look like a tooth, and then I'll get them to bite down. You're like, oh shit, the whole tooth is blue. And then after you carve it down, you're like, oh, now I got a flat tooth with no occlusion. Boom,
yeah.
Instagram.
So it's what happens, right? It does happen sometimes. That is reality too. But once you take the Elevate course, you take some good restorative course, you learn how to avoid that. So, and you gotta get thin articulating paper, Neki. Don't make it too thick, man. Get it really thin. You know, if you take some microbrush, wipe a little away. That's
Man,
the key.
it sounds like your partners at your practice are your homies too. Like it sounds like you guys have a good time together. How'd you pick them to be, the people you practice with?
So yeah, they're two guys that they were 2 years ahead of me in dental school, and they are like the best of friends when they were in dental school too. They traveled the world together, and we were always the like social ones. We would go out and we would meet each other, hang out, get to know each other. And Winnipeg's not a huge city. Where it's growing a lot, but there's not a lot of people who want to go and necessarily start new practices and take on risk and do something different. But that was Todd. Todd had come to us originally and said he had this vision of something really cool, a unique practice that we hadn't seen in Winnipeg before. So it all resonated with us, and yeah, we just took a leap together, and we bought an old practice and then built a new one at the same time, like across the hall. We're in a mall here, and then moved everybody over, and we opened up 2019 February. So
Oh,
what
nice.
happened in March, and like it's a roller coaster, but it's nice having my two buddies doing it together. we cried on each other's shoulders a lot. There's some sleepless nights for sure. But yeah, I wouldn't trade it for anything. It's so nice working with people that think alike and they want to do better all the time. It keeps pushing us.
One of my, so I have two partners, and one of them used to be one of our old associates, and he worked with us for 5 years, and we're like, man, I don't want to work without you. And now he's one of my best friends, and we've never actually gotten into an argument. Like he always backs down whenever I question him. He'll just be like, yeah, whatever you say, Nicky. Have you ever gotten into like an argument with one of your partners, and especially now that, like, it sounds like they're good friends? Like, have you ever thought about what's going to happen when that time comes, if that time comes?
Oh man, we fight every day.
Oh, really?
If we're not having an argument, it's not we're not at work that day. So some vacation it means. Like, but it's a good thing though. Like the three of us are so passionate about dentistry and about like the patient experience, like everything outside of it as well. And with that comes opinions, right? Like we're all opinionated about certain things. There's certain things that we care about more than the other two. So yeah, we get into these heated arguments, but the one thing we always said to each other was that it just comes from a place of passion and wanting to make this the best thing possible. So yeah, like we'll get into a discussion, but right after we're like, fist bump in, have a beer together, whatever. Like we're always still friends. Nobody takes it too hard. It's all about making the business the best it can be. So, and there's times where like the wanting to just agree comes from like I'm tired right now. I don't have it. So it's nice having the other guys like have the fire and passion because this burnout's real and you can't always be 100% on your A game as much as we try to. So being able to bounce energy off each other, it's awesome. But yeah, the reality is for anybody out there in a group practice, like sometimes there may be disagreements, but that's okay. It comes from a good place.
Was it always like that? Like, did you select these two buddies as your business partners because you knew that you could sort of shoot the shit with them and speak to them frankly about stuff, or did it become that because you were in the trenches together for so long?
Yeah, I would say it more became that. That's not something that we had thought about before. A lot of people will tell you, like, don't be partners with your friends, don't
Yeah.
want to be with friends. I mean, I get it. I can see how it could get, tricky between certain people, but if you set that ground rule, just like, hey, we're all here for as friends, so let's keep that in mind. But if it gets heated, it's passion. So there was that, but we hadn't thought that would happen. We were like, oh, we're so easygoing. And the one thing that brought us together in a weird way was like we had all worked in places that were doing things that we didn't like. And when we had met up, we're like, oh, I didn't really enjoy this part and I would do it differently. And we were all like, man, we're all on the same page about things that don't make sense to us. But now being owners, I'm like, yeah, that kind of made sense. Yeah. When you're an associate, you're like, no, that guy doesn't know anything, I wouldn't do it like that. And then yeah, once it becomes real, you learn pretty quick. But yeah, that's what brought us together. And it's just figuring it out along the way. But it's such a fun journey.
The thing that I really appreciate of what you're saying right now is all your discussions with your partners are about how to elevate dentistry, about how to bring dentistry to the next level, and you're constantly pushing each other to do that. But what about like the finances, man? Like if one associate or one partner outbills another, and then it all goes into the pot, and then at the end of the day you split it up. That's how I find partners get into trouble, and they feel like some people are working harder than others. Have you ever come across that type of situation? Because I feel like there's friends, but then when you start including money, this is why partners don't work. Have you ever run into this scenario that costs are just building up and then people get mad at each other, or no?
Uh, Not like so specifically, but I see what you mean. But for us, it's like a friendly competition. Like
Yeah.
every month, we're like, oh, well, who did what? And like, I took it home in January, and now February, like, one of the other guys won and try to rub it in my face, and so we try to keep it like into a friendly competition because
Yeah.
it just drives the office better. I've heard so many stories about people like down the line saying like, yeah, it just got too much that they weren't carrying their weight or whatever. So we all try to we all sort of we did create was like minimums. Like you need to create this in a minimum in the practice, and if you're not doing that, then it hasn't happened yet. But we're like, we'll have to figure out how you're going to contribute to the practice if you haven't hit this minimum. So that was one thing that we set in place, and a lot of it comes too from that. Like I'm away quite a bit with my speaking and taking CE like I'm just a forever lifetime CE junkie. And I love doing it. It just keeps me going. But I got to carry my weight at the practice too. So we get creative in finding ways to make up time. But yeah, we haven't had the specific problem yet. We try to do everything that we can to avoid that.
Yeah. How do you like I had a conversation with a trio, similar sort of, you know, uh, they were all friends in dental school. They went into business together. And one thing I found, I won't mention them by name because, this was a off the record conversation, but they're like, we figured out that this person, is huge on social media. Like this person's, really good at marketing, and this person's really good at like communicating, and this person's really good at finances. And none of them, they're all intangible sort of skills. How do you value like into like your business partners can come at you and could be like, dude, I got 15K followers. I'm a big deal. Right? It's like I got the clout. So it's like, how do you value intangibles in business relationships?
And so that's another thing that I don't have an exact formula or number for that, but it's important to take that into consideration because sure, I have a lot of marketing power. Like I have a lot of followers and people come to our practice is in downtown Winnipeg. So downtown Winnipeg completely collapsed after COVID and people weren't at work, which was a majority of our patients were people who worked and lived downtown. So that was a huge hit. So we had to get really creative with marketing and through my whatever clout that I had, we were able to bring in people and kind of keep the new patient stream flowing and word of mouth stuff, and it kind of grows from there. But when I'm doing that, like my partners are, doing the QuickBooks and like running the numbers, and like guys are taking care of HR. And so I think it's what we do though is that we sit down and we assign roles to each other to try to
Yeah.
divvy that all up. We have a lot of meetings, like a lot of communication, just trying to get everybody on the same page. Because if you don't talk about it, you assume everybody else is doing it, that no one's doing it, and things fall by the wayside. So, but yeah, it's a good point to bring up. Like, there's so much value in that. Like, I am a horrible numbers person. I can't sit and do the books, so it's invaluable to me to have a partner who, like Todd, just he loves the books and loves doing that stuff. He's so good at it. So yeah, you do have to take that into consideration.
Yeah, I totally hear you. Like I said, we have three partners, and I take care of the numbers. One person does HR, one person fixes all the crap that that I can't even hang a picture on the wall. And I'm like, man, go hang these paper towel holders. But looking from a new grad point of view, they see Sunny Virdi, they see a super talented dentist, and they're like, like me, man, I don't have your hands. I wish I had your hands. Man, I could pull teeth so fast if I had Sunny Verdi's hands. And thank God he's not embarrassing me, not doing surgery. But like, where can people learn to do what you're doing? Because it's not from dental school, man. Like, where did you start? Like, tell us your journey.
So, following back was about, I met John Trinakis here and he introduced me to Jose and I joined the Spear Study Club. So I started learning more about interdisciplinary care, which was nice. And then they started bringing in some amazing clinicians like Victor Guerrero taught me the rubber dam. And I really think for anybody, I'm a restorative guy. I can't, if you need surgery, you talk to Neki. But if you're looking for restorative stuff and you want to get started, isolation is so key.
Yeah.
You need to you need to have the freedom to work. And I think the isolation gives you that freedom because when you're learning in the beginning and you're trying to be, a master with resin or you want to do all this crown and bridge stuff, you're going to make mistakes the first time. But with isolation, you can correct those mistakes. There's no contamination. You're like, oh, I'm just going to take this away and redo it and reshape this area, which happens all the time. But when you don't have isolation and you do something and you pull your matrix out, what happens is blood everywhere, right?
Yeah.
He gets all happy from that. I don't. I don't want to see that. So now then that's when stress starts setting in and you panic. You know what to do. So I think isolation it doesn't get talked about enough. The people call me the rubber dam guy on Instagram. You gotta get your that skill down, and from there you have freedom to do whatever. You try different techniques. You can correct stuff like resin. The reason I love resin is it forgives you. You can correct it. You can change it. You can add. You can take away. It's not often we get to do that in dentistry.
For
So
sure.
from there, I started taking a lot of Style Italiano stuff. And I don't know if you guys have seen them.
I've heard of it. Yeah. What
Yeah.
is
No.
that?
So Jordy's coming to PDC next week, and he's like one of the big bosses from Style Italiano. But their whole message to clinicians around the world is so cool. It's like we want to bring high quality aesthetic dentistry to the masses. So how do we make this repeatable? I promise you guys, I have really bad hands. Like you ask my prosthodontic scores are horrible. I'm still not like a super steady hand, like do beautiful work. It's not me. Like we take the same class, you have way better stuff than me. But I keep working. I go home. Like I heard Bob Margis, Fresh, who's one of my biggest mentors and closest friends. He told me he's like when you call Bob Margis on the phone, he answers, but he's working on teeth at home. Low plastic teeth. He has a little motor, and he's doing class fours at home.
What?
Yeah, he still practices. Like every I don't know if every day or whatever, but he still puts in his time and how good he is. So I started doing that. So I bought all that stuff. I have it at home. When COVID happened, every day I would wake up, like people working on their prison bods and like getting in shape. I was polishing class twos and class fours. I polished more class twos, I think, than most dentists hope to in their lifetime. Just at home, just sitting, polishing. I love it. It gives me a lot of job satisfaction getting good at that stuff. But learning their techniques, they make it so simple and repeatable that you can do that day in and day out. And then, yeah, literally just taking that information. You take a couple of different pros from different people around the world, the different courses you go to and symposiums, but really it's about incorporating it into your practice. Because I see people all the time take courses, even myself, you go take a course, you come home, you just like forget about it.
That's the most deflating feeling, man.
Yeah,
Oh,
it's like implementation is hard, so you
yeah.
gotta have a plan. But yeah, it's just like I sit at home and I work on this stuff and I take time to talk to my team. But hey, we're doing this. It's gonna suck day one, but it's gonna be so worth it, 2, 3 months later. And so we set these little goals like that. But implementing the stuff you learn um, Monday morning is crucial.
Man, prison bod. I'm dead.
Yeah.
You had
Maybe
I'm
on
like,
his online fan page, right?
yeah. Yeah, Sonny was having a hard time coming on the show and because he wasn't signed in to a Zoom account. So Neki was like, "Get off your OnlyFans email," and Sonny goes, "It's my OnlyFans, no, OnlyFans." Killer.
Yeah, there was like this trend going on Instagram for a while. People would post like onlays and then they would put like hashtag onlay fans.
But Sonny, man, like I see your work, and at school we get 3 hours to do one resto, right? So like I can sit there for hours, and I can probably even use that like hand sander, and I can get some of the contours. Actually, I can't even get any of those contours, but
Let's be honest.
yeah, exactly. It's like I can maybe get one
You could, in
in
theory.
3 hours. But I see you, and I'm like, man, like you have such incredible skill, and it looks like it takes so much time. So for one, how long does it take to do some of those restos? And two, how do you justify that time? Neki and I were just talking about it before the pod, and you have a photographer, and then you have to make it perfect because you know that you're going to get grilled on Instagram from a bunch of dentists. So like, how do
Yeah.
you justify that when you basically are doing that same resto and getting basically paid the same amount as anyone else just doing a quick class, like 2 or 3 or whatever it is, but you're spending so much more time?
Yeah, and to add to it, even it gets worse. Like there's more pressure now because you end up almost in your own head, right? You're like, okay, I post this quality of work, and if it's not better than the last time, like, what am I? What am I
Yes,
doing?
I 100% agree with that. You got to be better. You always got to be
Yeah,
better.
and
Yeah.
then you're like, what can I do? How do I make this better? And then you drive yourself crazy. Like, for I don't know about everybody else. The reality of social media is for every case you post, there was 20 cases you did that they didn't turn out, and the one you're like, this is the one that you posted. That is the reality of it. It's a highlight reel, right? But no, the protocols, like Presh and I talk about this a lot, and the protocols we developed focus on that it's repeatable. It has to be, you have to be able to do this day in, day out. I can't like put 4 hours of effort into this one tooth just to kill the rest of my day, or the next day I'm too tired to do anything or care about it. It needs to be repeatable for every patient. It needs to fit into private practice because we have a 8-chair practice here. We have 4 hygienists. Sometimes all 4 hygienists are my patients, and I have an hour. Like I book on average, if I'm doing a quadrant of restos, like 2 teeth or less, I'll do an hour. And if I'm adding 3 or more, maybe I'll book like an extra 15 minutes or half an hour if it's a lot of teeth or a hard case. But it's all like, shorter appointments. I
What
don't, I
is that
don't,
relative to like other dentists? Is that longer or shorter?
I think that some people maybe see patients every like half an hour. Like I can get a restoration done in 10, 15 minutes, no problem. I just like to talk and hang out and I go and see the hygienist. Like I don't rush. But these restorations, like each restoration, if I had to really time it, I could say 15 minutes
That
per.
is absolutely insane.
Like it's quick.
That's impressive as
I
hell.
know it looks
Wow.
like I spent hours, but I don't because it's not real life for me. I don't have time. There's the financial pressures of running a business and opening a new practice. Like that's reality. And patients also can't sit here for like ever. So I got to give them the right experience doing dentistry the way I think it can be done the best. And then doing those little things that people say, well, you put grooves in teeth and this and that. Like, does that really help patients? But for me, it's important that I have a satisfaction every day of what I do and I take pride in it. Because I gotta do a quadrant of class twos before I used to like, oh man, I don't want to do this. Like this is gonna ruin my day. And now I look forward to it. Because the reality is for most general dentists, posterior, composites, and crown and bridge are the majority of our dentistry. And so we want to take pride in that. So I wanted to make it work in private practice, but still find joy out of every single appointment. And patients love it. They can tell how much fun I'm having, taking pictures. And I show them the pictures after, and they're like, "Man, you love teeth." They're like, yeah, I really do love teeth.
But
OnlyFans.
So
Sunny man, I
yeah,
can totally see it. Like it's pride. At the end of the day, it's not about finances. It's not about seeing as many patients, watching your practice grow. It's feeling satisfied that you did something awesome today. And I can see it bursting out of you. And I can't say that for 98% other clinicians out there. So I think it's amazing, dude. And you're only out for 5 years, man.
yeah, it's so much fun, man. You got to have fun every day. So one thing me and my friends always talk about, like anytime we're thinking about something about patients or whatever, we're just like, hey, make sure you're having fun. And patients love that. Like they want to be treated well. They can tell you're having a good time. They end up getting better care as a result because everybody's enjoying themselves. And yeah, like I love it. Leaving people with a positive image of dentists. Like we don't have the best public image. So whatever we can do to slightly change that, make them feel better, I think it's worth it.
I love that you just recognize that. That's sick. But it's true. It's like, dentistry, healthcare, it's like patients, patients, patients. I want to help people, help people, help people. But at the end of the day, you have to realize that it's a job for you and you have to enjoy it. So you have
Yeah.
to get that satisfaction from it too, right? So like, was that intentional or did you just find that after the fact you were like, now that I'm getting good at it, I'm starting to, get purpose from it now?
Yeah, it was after the fact for sure. But it come from mentors saying like, once you see dentistry like this, you'll have fun. So give it a chance and try to learn it this way and see it this way. And once I start implementing practices, like you're hooked. Like this is so fun. This is amazing. And like part of the reason I was so frustrated in practice was that I felt like I didn't know what to do. Like I was having open contacts, like things that just like day-to-day problems, post-op sensitivity, my crown margins. I don't know what's going on. I don't know what material to use. Like, in school, I know they're doing the best that, they can. Like it's a tricky situation and it's easy to rip on the universities. And I know it's a hard job, but the reality is like there's a gap between what happens in the university, and what happens in real life. Like they're just two separate things. And I felt like I didn't have anybody to go to. I didn't know, okay, like I have these problems with posterior residents. Like, who do I talk to about this? Because it's almost like this is what I was trained to do. How do I not know the one thing that I'm supposed to know? Like, how do I know how to fill a tooth in the back? But learning how to troubleshoot all those problems and day to day having like predictability, like, oh, this is I know exactly how this is going to go. I know how to fix this solution, or sorry, I know how to fix this problem. It gave me a lot of confidence. And patients are like, when issues happen, I know how to solve that. And that gave me like the joy of going to work every day, not being like scared. I don't know what's going to happen. I don't know how I'm going to solve these problems. That's where I was when I started. I mean, look this way. When I graduated dental school, I had more hair than Neki. I'll show you a picture.
Well, I
Was
don't
like,
know
yeah.
anymore, man.
Oh
I had,
God.
man,
Where is this going?
I had just like as much hair as you did, Kill. I had so much hair. Even my driver's license, it's not that long ago. My driver's license still has me with a full head of hair. Okay. 6 months later, I shaved my head. It was not
Intentionally?
a good time.
Please
It's a
tell me
picture.
intentionally.
They show a picture of me at my grad. Like, it was, I was balding a little bit, but I still had hair. And me at grad, and then when my wife got into dental school, going to her like thing, a picture 6 months later, bald. It's
Oh
so it's
gosh.
so funny. So yeah, I didn't have a good time when I graduated. I've
Have
been
you
through
have you read gosh, now I'm nervous about my hair. I'm gonna be checking the floor of the bath. But man, have you read the book So Good They Can't Ignore You by Cal Newport?
No, I haven't.
Have you, Neki?
No.
Okay, so I just finished it. I finished listening to it on Audible. So basically the premise of this book is you think passion precedes um being good at something, right? So like you think you're passionate about something, then you get good at something. The whole premise of the book is that relationship is flipped. You're actually good at something before you become passionate about something. And this is why it's so important because you have a lot of young people like me going around saying, oh, dentistry. I'll use the dental context because, we're talking here, but it's like dentistry, like I'm not passionate about teeth, screw that, like a cusp, like a groove. But what they don't understand and what I'm actually starting to learn now is and exactly what you said, Sonny. It's as you get better at it and as you get good at something, that's where the passion develops. It's not the other way around. It's not you wake up one day and you're like out of the womb, oh, I love teeth. It's like you don't even have any, right? It's like you got to get good at it first. And they did this study on no diss to like EAs, but like an EA job is not something that someone, young is like, I want to be an EA one day, right? It's like a job that people do, and it's by a lot of respects, it's just a job, right? It's not like a calling. But they looked at EAs that had been doing it. They stratified EAs on three categories: ones that had just started, ones that were mid career, and ones that were end career. And they asked them, what like do you like rate on a scale from 1 to 10, or rate on some sort of scale, how much your job you think is a job or a calling. And they found that all the EAs that had been there for longer rated it more likely as or more as a calling than the young EAs, meaning that like as they got those repetitions in, as they got better at their job as an EA, they became more passionate about it and they thought it was a calling versus a job. So I love that you said that because you just exemplified that exact thing because you said, I got good at it first and then I became passionate.
Yeah, it makes it fun, like when you are good at it, it just makes it easier. So of course that's easier to love. But yeah, that would make sense.
And now you have probably the dream team of Canadian dentistry. You have Sunny Virdi, Paresh Shah, and Gordon Shee, all phenomenal clinicians, and they've come together to teach Canadian dentists, well, I guess any dentist across the world, how to do what they do every day, how to be the master of their craft. Tell us about that, homie.
Man, it's amazing. I never would have thought that that's something that I would do in my career. But I got to give a huge shout out to these two guys. Now, Presh and Gordon are such good clinicians, and they're even better people. Like these guys have the biggest hearts, and they've taken me in and treated me like family, and it's been invaluable. Like as a young clinician, as you go through your journey, like it's so easy to get caught up in so many things, and there's so many trends, and you get lost in everything. And it's so nice to have like guiding voices like this that just they start to ask you questions, and those questions make you have those aha moments. You're like, oh, okay, now I'm starting to put it together, and you're starting to understand where certain skills might apply better, how to kind of filter through certain things. So these guys like critical thinking skills are incredible. So Presh, who's been lecturing for feels like forever, and he's such a I tell you his reputation. So I went to Seattle Study Club last year symposium in Laguna Niguel, and he was coming later. Him and I were doing a hands-on program there. It was a huge honor, and Presh had to come later. It was COVID. It was hard to travel. And when I got there, every single person was like, "Where's Presh? Where's Presh?" And I'm like, "Oh, he's coming later. He's coming later." And there's like this. It's not symposium unless Presh is here. This is a huge meeting, one of the biggest meetings in the world. And every single person was asking where he was. And what I thought was the nicest thing was someone had said, "You know what that man exemplifies is that he has integrity." I was like, man, you know how cool it is behind your back? People usually
Yeah.
talk trash, but behind his back, they say that man has integrity. That's so cool.
Yeah.
So
Why do you think that is? Why do you think that is?
then he sticks to his values. Like and I've seen like, so many opportunities come your way. And I'm always like, Brash, look at this opportunity, look at that opportunity. And he's like, does it align with your values? Because things will come. Like everything's exciting when you're new and it's brand new to you, but things will come your way that may not align with your values. And just stick to what makes sense to you. And he's done that. And he's never like, quote unquote sold out. Like it's always been what makes sense and what's the right message, and thinking about his colleagues and patients. Like that's always his what's it called, priority.
Yeah.
And yeah, it just paid off after staying true to himself for so long. So he came to me and he said, man, you know what, like we need to do something in Canada, because there's CE everywhere, and it's not about a competition, it's not anything like that, and no disrespect to anybody else. We just said, how is there no like restorative CE in Canada? Like, there's lots of surgery, lots of specialty stuff, but like, man, what about like the day-to-day stuff? And he's like, Sonny, you're excelling at that. That's something that you're really passionate about. He has been too. And for me, I didn't want to. It was hard initially because being a newer grad, I was like, well, I don't want to mislead anybody. Like, I want to get my 15-year, 20-year follow-ups, and then I'm gonna show the world, look what lasted 20 years. But joining up with him, he has all that experience. He brings all that perspective in. So he's like, I'm gonna bring that. You're gonna bring the new protocols, and we're gonna combine those so that we have evidence-based, like predictability for clinicians, and the experience and practicality. So I was like, man, you can't turn that down. So we've developed a few different programs, and we have like a posterior course, sort of called like our starter course. And then we do like all class twos, we do onlays, and we do some anterior stuff. We do some class four composite work, and just try to show people like, here's things you can be passionate about that Monday morning you're probably doing. Like, let's take
Yeah.
this back Monday morning and incorporate this and get you like loving to do these procedures more, because the majority of dentists is what they do day in, day out. So that was really nice. And then we'd always been talking to Gordon, and Gordon's so good at what he does, and he's such a cool practice. Like, I don't know if you know his practice, but he's just aesthetics, 3 days a week. That's it. You come to him and he is going to make you look amazing. He does like other stuff too, but it's like majority is aesthetics. That's the
Yeah.
bottom line. So we'd always wanted to do, like, our first course is very single tooth dentistry, and like, here's how you do these treatments for one tooth, and you got to take everything else into account when you're treatment planning. But here's the skill, and then to get a little bit broader, now we're talking about aesthetics and facial aesthetics, and we did a veneer program. So a 3-day program, you come in, we do hands-on stuff, and then we bring in a live patient on the last day and preps a bunch of veneers, and in the afternoon we cement them, and it depends on the patients and whatever. Like, it's tricky to do live patient stuff, but try to always
Yeah.
have something new for everybody. So that's been really unique. And now we have a photography course that Gordon and I are doing, and it's under the Create umbrella. Like that's his brand, but all the same thing. And we're looking at maybe like a worn dentition thing. So we're hoping to bring to Canada single tooth dentistry, and then eventually looking at comprehensive stuff, because I think it's really important to have a balance of single tooth and comprehensive CE. There's lots of single tooth stuff out there, but when you don't have like an occlusal philosophy, and you're not looking at people as a whole, I think you can get into trouble when you try to apply like single tooth concepts to every single person. Treatment planning is a big part of that. So yeah, it's been incredible, and the reception we've had from Canadians, especially. We've had a few Americans come, but the reception from Canadians has just been excellent, because we wanted to bring high quality CE to mostly Canadians. Not that we don't want anybody else, but to Canadians, from Canadians, in your backyard. Because I think there's a level of understanding that we all have with each other. Like, our patients and the way we do our insurance and work is slightly different than America, even though the dentistry is the same. There's little nuances. So yeah, it's been incredible, and I love what we've been creating together.
So, Sonny, I feel like I wish I would have graduated a couple years later and would have met you earlier in my career. When I graduated, I took the COIS system, spent tens and thousands of dollars.
What's
And
that?
COIS is like a continuing education. It's like a system, like it's a multi-week, education, and it's phenomenal. Like it's considered one of the best out there. But I found it didn't resonate with me at all. And I couldn't apply the concepts. And I spent a ton of money, and more importantly, a ton of time trying to understand the concepts. And it didn't really click with me. And so I felt like I was a failure. I wasn't smart enough to do this. So I was always good at pulling teeth. And that was kind of how I got down this path here. But Sonny, I feel like if I would have met you and taken your courses, I maybe would have a different approach to my career right now. What do you say to the people that, you know, have gone down the spear pathway or the Kois pathway, and now you want to teach, you know, restorative, like you said, you want to do the whole worn dentition thing. And I think I'm going to take that course from you for sure. What do you say to those dentists that have tried so many different educational paths and it didn't work for them, man?
That's it's interesting. Like Kois has such a huge reputation
I
now.
know.
I actually have never heard somebody say,
I'm embarrassed to
"Kois
say it,
being
man.
no, no."
It took me a long time to say that, man, but I wasn't, it did not click with me. And I can say that now, but at the time I was so embarrassed, man. I was like, what the hell am I doing in this profession? I don't belong here.
Oh, it's real, man. It's real. I personally think that like you gotta go and you did Kois, but did you do spear or panky or DOS? Like, did you do any of that?
No,
So I
I
hear from a
decided
lot
I
of
hated pros though and stopped doing it.
just take them out, man. You can't check the occlusion on the table. Take 'em out. Fair enough. So yeah, I think it's important to have one of those in your back pocket. Like, I would go back and say if you took all that, like whatever you're doing now, I mean that knowledge is still with you. And there must be times where you're like, okay, I can see why this is a problem, or I can see where problems are going to come because I do get that. And maybe that exact protocol doesn't resonate with you, and you maybe a spear thing would be more, your approach, or maybe, a Dawson would be more your approach. So I think it's important to look at all of them. But yeah, I don't know. I've never had somebody come and say, this. Usually these people are so hardcore about those
I
things.
know,
Like
man. I'm
you gotta
sorry.
like, hey, just like take it easy. Like let's talk about some other stuff. But one thing for us is like that being able to implement what we want to talk about and teach you, and being able to do that day in and day out and have it be predictable in your office, that's the most important thing for us. So whatever background you're coming with, I want to make sure. That's why we keep these class sizes so small, like 12 or 15 at most is usually what we do. I just want to be able to sit down and be like, hey, like, what do you need from me to make this happen for you? Like, I want to make you so proud of what you're doing, and I want to see you like grow into this amazing clinician, or make you better. And we offer that support after, and it's like we try to stay up on top of keeping like new information out, and like staying in touch with people so that if they have questions, because sure, it's easy on the type, but when you go and practice a little bit different. So I want to offer that to people, but it's all about implementation.
I absolutely love that. Like I love hearing that. And I think that's what a lot of course providers are starting to understand. Because I try to do the same thing when I teach people how to take out third molars. Like I'm like, homie, here's my cell phone number.
Yeah.
Text me, like let me know how I can help you. And I feel like you're the exact same dude teaching. And I'm not shitting you, man. I wish I would have gone down that restorative pathway with someone like you who would be open to letting me ask you questions. And when I have a shit day at work and a restorative case didn't go well, a cementation of, a set of veneers went really horribly, my isolation was crap, I can turn to you and be like, yo, Sonny, man, what did I do wrong here? And what do I have coming up?
Totally, man. It's a hard profession, and like
It is.
we get caught up, and sometimes we're the only people in the room and the only people that understand the situation. But if you had a network of people that understood it, it makes things so much better. And I've seen the power of some of these groups like grow. And like I look at the American Academy of Clear Aligners, which I've taken and become a part of, and the way they grow and support each other is so amazing. This is Seattle Study Club's the same way. Like when you go to these symposiums, man, these guys all sit like a family, and everyone talks about their problems. They each try to grow each other. And I see the same with spear docs, see the same with koi stocks. So I was like, I want to bring that here to. I feel like Canadians didn't have a lot of that in terms of restorative.
Yeah.
So we are creating a tribe, and it's been so nice. Keep staying in touch with everybody. People have questions after. I feel like people are actually learning and implementing into their office, and it makes me so happy.
Yeah.
Seeing colleagues like thrive is what really gets us going. I just love sharing and love watching everybody win.
Yeah, and I can see it coming out of you, man. And one clinician to another, one course provider to another, I can see it in you, and I'm proud of you, dude. And dude, you're at PDC next week too.
Yeah, we're at PDC next week. I had to speak Saturday morning, which I'm excited to be at PDC with Saturday morning.
I know. I'm sorry, dude.
Anyway,
No one's gonna come. I'm just telling you. I'm just
yeah, anybody who makes it, I will appreciate it so much because I know that the Dental Corp party is Friday night and that party is legendary.
Oh, come on, man.
So
Sunny Virdi
it'll be
is in
good. But
town.
man, you want to hear
Everyone's
what's
gonna be
really
there.
exciting? We're gonna share the polish up these class twos. I'm gonna show you class twos you've never seen in your life. So it's gonna be an incredible
Oh,
time. Just short ones for an hour. I'm gonna give you some indispensable tips. So it'll be really nice. I'm looking forward to it, man. They have a stacked lineup this year. And then if you ever come a chance, if you have a chance to come check out my lecture, awesome. I'm going to be at your lecture. I don't do surgery neck, but I'm just going to come hear you speak because
Oh yeah.
I don't know if people tell you this. If you ever get this, people not mistake, or they ask me if I'm you or if I'm related to you.
really?
But man, I get this question
What an honor
literally.
for me, man.
You
And
guys have
yesterday,
hair on opposite poles of your face.
I get confused with people all the time. Super weird. People ask if I'm Italian. People ask if somebody asked if I was Kobe Bryant once. Like I don't
I
know
see that. I
how
see
I
that one.
get asked all these questions,
He's
these
alive.
weird references, but people ask just yesterday. Somebody sent me a video of PDC, like the page. I guess Neki and I, you're on the same page, and they were like, I thought you were the same person. I
Oh
didn't
God.
realize there was two of you. Just yesterday this happened. I don't understand still. It's like you have hair and I don't. It's a clear distinction.
You guys look
But
so
Oh,
different. I don't get it.
we're
yeah.
brown. I think that's where the similarities end, right? He's got
Yeah.
muscles. I'm just tall.
But yeah, I remember walking into a lecture once, Nicky, and I think you were playing like a shanty, and I was like, "Oh, I'd be good friends with this guy." This was sweet.
I was not playing Ashanti, man. Come on, dude.
It was either John Rule or Ashanti, man, for
Probably
sure.
Ja Rule, man.
And
I was playing
and
Ja
if it
Rule.
wasn't, it was the convention putting it on for you. But it was very fitting. No, this guy's a cool guy. Yeah, like Jordy's gonna be there on Thursday, I think, speaking, and that's one of the guys I learned from. So I really encourage people to go check him out as well. But this year is so huge, the stacked lineup for PDC.
Yeah.
I'm excited to be a part of it and connect with everybody. And yeah, if you're out there, come say hi.
I got a question for the two of you. Mixing it up a little bit. Why is it in dentistry that dentists love, like all dentists love to teach, and it's so unique to dentistry, and it's not like, I have a lot of doctor friends and like it's not nearly as prevalent, but why do dentists love teaching so much?
I'll let Neki take this. I have my own answer, but I'll let Neki.
Honestly, I wanted to teach because I feel like I live on an island and there's no one around me that I feel I could learn from. And I had to learn the hard way from so many people or from so many of my own failures. And I didn't know the people to seek to help me. And I thought it would just be amazing if I could start to help the people around me because we all get into the same shit. We're all going to break root tips. We're all going to break tuberosities, lose roots here and there and get into trouble. But how do you learn from that? And I thought my way of giving back to the people around me and to the profession is to share that we're all human and we're all going to get ourselves into trouble. And that's always been my mentality. I can't tell you I'm a great surgeon or good at doing what I do. I'm just, I think the thing that differentiates us is my experience may have not gone as great as maybe your experience has. So I want to, teach by showing my failures. And that's why I do it. Sonny actually has legit cases to show. So I'm interested to hear his answer here.
No, man, kudos to you. Like, people rave about your stuff. Like Murad, my partner, is taking your course. And I think he was talking to you about it. And he does a lot of surgery. And he was like, man, the amount of tips I learned from this guy and things that like I've been working for X amount of years doing this. I thought I kind of knew it all. And he just learned so much from you. So you're doing a great job, man. People love your
Thanks,
stuff.
homie.
But in terms of why I did it, like I had taken so many, like hundreds of hours of CE, and I was like looking at my colleagues and thinking like, I did it, and like I took a lot of investment, a lot of time, a lot of energy, a lot of effort, but I know it's not realistic for everybody to do that. I was lucky enough to just be in a situation that I could and I knew where to go, like had great mentors who kind of directed me. But like the average person, how do you get trained by Victor Guerrero in Peru and then like these guys from Italy and like how do you put this all together? It's not without knowing them in the first place. Like I had no idea who these guys are. Maybe you guys have never heard of them even. So I was like, yeah, I'm gonna put all this stuff together, because people keep asking me all these questions. The other thing was like, when you learn, a lot of times it can be like show dentistry, like look how amazing this is, but the reality of how that dentistry was made was like, oh, like my whole family is, like my brother is this, and my wife is this, and my sister is a periodontist, and our whole family treated this patient. Like, okay, that's really cool. It's amazing to see, but like, how do I apply this to my situation? So a big part for me, I felt like there was a gap there, and I was like, I want to bring the best dentistry that I think exists out there, and way to improve, optimize our direct and indirect stuff, but in a daily clinical practice. That's like, hey, I got hygienists, I have partners, I run the average practice that most GPs do. I want them to feel like they have a resource as well. And I didn't think that was always there, especially for Canadian docs. So that was my big starting point, was like, let me try to bring all this information for you guys in a way that's digestible, where you're not spending as much time as I did. Hopefully you can leapfrog the whole learning curve, and get to a spot really quick.
I like that, because you're like distilling all the hours that you've taken and you put it into this course. So I think every dentist should be doing your courses, and I think that you provide a lot of value. If people want to learn more about it, where do they go?
Check out my page, DND Sunny. So in my bio, I have a link to all of our programs, and then same with Presh, Dr. Presh Shah on Instagram. If you go to his bio, you see all our programs, and we kind of do a lot of it through Instagram, because we find that a lot of the like-minded people, that's what we've connected through. And even if not for the courses, like, just send us a message. Like, it's so fun meeting new people online. I don't know how your guys' experience with Instagram has been, but it's been like life-changing for me. Like, me getting to talk to people you've never met before, and like people that inspire you. It's like, let's just keep forming our network and like growing together. But yeah, everything's in my bio and Fresh Shaw's bio. So easy to find.
And he's not kidding you. I remember when I was speaking at the Manitoba Dental Conference, I reached out to Sunny just online and just told him how much I admired him. And the first guy who shows up at my lecture is Sunny to come say hi. And honestly, man, it means a lot to me. And thank you so much for coming on the pod. And I don't know if the world has heard enough of Sunny. This guy's hilarious, man. So I could talk to him forever, but I'm sure everyone else would get bored. So thank you so much for coming on the pod, and I can't wait to see you at PDC next week, man.
Oh, so nice to meet you guys, man. Thanks for having me on. I appreciate it. We'll catch up soon.
Absolutely.
Welcome to the Hi, I'm Neki. Is that a sweater?
Yeah, dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is zero, to charity, because we are losing money.
I wonder if the charity will pay us. I think we got something here, man. Let's keep on losing money on every sweater.
Alrighty, guys, go check us out. hiimdoctor.com.
We'll see ya. Man, that was such a wicked episode. I love talking to Sunny. He's just such a humble dude, man.
Who's Sunny? I thought it was Kobe.
Oh, Kobe, yeah.
Brown Mamba.
The Brown Mamba, yeah. No, man, the guy's wicked. I really enjoy him, and I really think he is going to be the future CE leader in Canada. No doubt. No doubt in my mind at all.
Yeah, it's just like you mentioned in the podcast, like it shines through how passionate and how energized he is talking about dentistry. And, like, I think you can easily make the argument, like we talked about, passion and developing your calling. It's like you could easily write off anyone who's passionate about dentistry and just be like, it's teeth. Like, what are you so passionate about? Like, you like weirdo. Like, when people know I'm in dental school, like, what, you like teeth so much? Like, what's the reason you're in dental school? It's like, but it's cool to see someone that's young, someone that's passionate, and such a good communicator. Like, that's such a hard thing to come by.
Oh, there's no doubt at all. And I think meeting him in person when I met him at the Manitoba Dental Conference, he's just such a big personality, man. Like, and it's funny because I was there alone. I didn't know anyone. And there was this big gala dinner at night, and I was just kind of sitting on my own. And you could hear people, oh, look, there's Sonny. Man, let's go talk to Sonny. And he's just the guy in the province. So he's such a cool dude, man. And I think it was an honor to have him on the show, and maybe even gave us a bit of street credit just to know him too, right?
Oh, totally. Yeah. Yeah, we're definitely going to have him back on the pod. I think there's so many things that we were talking about just as it ended, like being super passionate, owning a practice. He says he drills at home, for fun.
Yeah.
But then right as we're getting off the pod, he was like, I'm going to a Jets game. So it's like he still has a life, which is pretty sweet. So I want to ask him more questions about that.
Yeah, no, he was a good time. I can't wait to see him at PDC next weekend, and I'm gonna go to his lecture as well and pick up some polishing tips. I think it'll be awesome.
Yeah, and if you're going to PDC, I don't know if this episode's going to drop before PDC.
Oh, it probably won't.
Yeah. Well, next year, go see Necky's course too, because I've watched the guy lecture, and he's a beauty at it. He might even get a shout out. You're really interactive with the audience, eh?
Oh, thanks, man. I try to. I always pick on the people with good hair.
Okay.
I always feel like, I appreciate a really good fade. So I always go up to the guys and be like, man, you got a tight fade. Let's talk.
The good fades. For a second, I thought you were talking about me, and I was like, oh, I just looked really stupid there. It's like,
no,
I was
man.
Like, pushing back the compliment. Anyways, hope you guys enjoyed the episode. Yeah, Sonny is sick. Thanks, Sonny, for coming on the pod.
I love that guy. All right, we'll see you guys next week.